We're here to talk about the supply chain and the built environment in healthcare. It is an HSW credit, so as Nick said, please make sure he has your AIA number to report it for credit. I'm Melody Vandivere. I'm founder and principal of Maia Consulting here in Denver. I know most of you from being out and about different organizations around Denver, and I'm excited to be here.
I'm Adam Hurst, principal with Maia Consulting. I joined Maia in January. I moved from Texas to Colorado in the middle of the pandemic. So it's been kind of an interesting move, but I'm excited to be here and meet y'all, hopefully meet everybody in person someday.
Okay. So there are learning objectives for the HSW course. We're going to go through the 4 main objectives, and we're going to kind of hit on everything throughout the presentation. We're going to compare methodologies affecting room design, explore the value of involving supply chain early in discussions. As we all know, the earlier the better, so that we don't get disruptions later in the process. Identify supply chain needs and the importance of quick access to critical equipment. This ties into the health and safety of patients and caregivers. And then talk about how we can apply flexible design principles to accommodate the different methodologies and changing safety standards and local codes. All right.
So just a little personal thing about me. I'm a fan of the show Friends. So if any of you have ever seen it, this picture might look familiar to you. It's when Monica's got her secret closet. So that's the title of the presentation, is the one with the mystery closet. I feel like supply chain, if any of you have ever done a hospital inventory or a walkthrough of an existing facility, you get to the supply closet and sometimes they look like this. It's kind of hard to figure out what all this stuff is, but that's what supply chain does. Is the responsibility is to get all this stuff, all these supplies, find a way to organize it, distribute it, and then restock the floors so that the patients and staff have quick access to what they need when they need it. So it's a big safety aspect to make sure that the patients get the supplies they need when they need it.
So we talk about supplies. What are supplies? It could be anything. It could be from ventilator tubing to face masks, electrode pads, wound care products. It could be a wide variety of things. The amount of supplies and the type of supplies are going to differ depending on what floor, what department, what area you're in. A cath lab, for example, has different requirements than an OR. A clinic is very different than a nursing unit. But all of these departments consume supplies. They all have disposable things that they have to go through. And they all need nearby storage and frequent replenishment so that patients have what they need when they need it.
All right, so typical supply chain workflow. Most of you might be familiar with this, but we're gonna go through it all anyway. So hospital orders supplies from one of their main distributors, and typically they show up on a very regular basis, usually daily. So the truck, I gotta point at the right screen. The truck shows up at the hospital with all of these supplies. Your supply chain managers and the team unbox the supplies, organize it, catalog it, and then distribute it out to the floors. All of this is synchronized with the supply chain management software, so big technology component. And then from the supply rooms, it's distributed out to the patient floors to take care of patients. So that is a quick supply chain workflow, but what we're going to do in this presentation is break it down into different pieces and talk about each step in the process and break it down and how supply chain can affect the design of the built environment.
So at the beginning of this process, we have receiving and distribution. So we'll have trucks that come to the loading dock and to central supply with bulk supplies on a very regular basis. They call it just-in-time deliveries. Most hospitals, especially in metro areas, have just-in-time deliveries. What that means is just the amount that the hospital needs until the next shipment arrives. So there's very little stuff that's stored, very little excess on site, and they're really relying on their GPOs, distributors, and vendors to have the supply chain in place to get everything on site as needed. What happens when the truck gets there, the bulk supplies are brought into the central supply area, stored in big boxes in the bulk containers, and then they're broken down as needed and distributed to the floors we put a supply transport cart here. What we're seeing, just because of the supply chain disruptions in the last few months, is that hospitals are starting to think about adding a little fat to their just-in-time lean process. I don't know, I don't think it's time yet to know exactly how that's going to affect the built environment. A lot of places in metro areas are going to offsite warehouses where they can still get shipments and they can stockpile their emergency supplies and PPE and stuff offsite and still have ready access to it. In more rural areas, they haven't fully adopted the just-in-time process, and we're seeing they keep their stock on hand. So there's a bigger requirement for the central supply storage areas.
So that covers kind of the first step in the process of what happens with the supplies when they come in. So the next step, we're going to talk about the actual supply organization in the patient care areas. Typically, we're going to talk about like a med-surg floor, a patient care floor. But two of the methodologies that you hear talked about, especially during design meetings, is centralized versus decentralized, or a combination of both. So it's important to understand what your clients and how they're going to deliver these supplies to the patient bedside. So the centralized model, I'll get into, I've got a visual on the next slide, but the centralized model is basically a central supply room, and the nursing staff has to go to the supply room and then back to the patient bedside. Decentralized is a method that gets the supplies closer to the patient care area. So this is an example of a project we did recently, and the red dots are the central supply rooms. So you can see the distance between the patient rooms, and the nurse has got to go like 1, 2, 3, 4, like 150 steps to get supplies and then back to the patient bedside. So it might be good if they're trying to count their steps, but from a patient or staff safety perspective, you want to make sure their workflow is as streamlined as possible. So that's where decentralized comes in. And this is all driven by the supply chain and where their supplies are going to be stored and how they're going to be distributed to the patients. So the green dots are the decentralized. So this is an example of a nurse server cabinet where supplies are housed just outside the patient room.
So it is important to say, even though we have decentralized stations in the patient rooms, we still are going to have a need for central supply storage. It just may be in smaller volumes and smaller rooms. Did I interrupt you?
No, you didn't. But I was going to say that typically the nursing staff is who stocks the green dots, and then the supply chain stocks the red dots. So it's kind of a double stocking, if that's the right way to say it. Supply chain brings the supplies up, and then nursing staff stocks each patient room as needed. So when we talk about the decentralized storage, it's basically extra cabinetry and extra storage space. So Melanie, I'm gonna let you talk about this.
Talk a little bit about how nurses are like squirrels. They like to squirrel things away. I think we've all seen this, how we try to design less cabinet space, less built-in space in patient rooms because things always get hidden away. You know, a few little extra Band-Aids here in the closet stay there for, months, years, and then, you never find them. So we have several different options for the way that we want to allow decentralized supply storage, to allow the the patient to have supplies that they need when they need them quickly, the nurse being able to give them the supplies without having to really leave the bedside and go back to that central supply closet. There are several options. I think we really are, as an industry, moving away from the built-in casework in a patient room, but we're moving toward more mobile, modular type of solutions. Things that go in the patient rooms or near the patient rooms, things that make sense to be distributed are things like PPE. Especially now, we need PPE closer to the patient because there are going to be more cases where PPE or where nurses are going to have to use PPE to go into the rooms. I'd say that's probably the case in every situation right now for every type of patient. We have also seen some, let me move this.
You can drive.
I'll drive the mouse for a second. This cart here is a bit more modular. It's a supply cart, but it's also got some equipment on it. So it can easily take all the caregiving supplies, the patient care supplies and equipment to the patient without having to have it built in the room. It helps with the flexibility of a room as we have to flex spaces and rooms based on different surges of patient needs and the surge with the pandemic.
This cart shown here is something that you typically see in like an emergency department. It's pretty high tech,
for sure,
as opposed to the one on the far right that is most common seen in a patient room.
Right. We are seeing a lot of carts like this that are kind of built in with some space in the patient room, but they're still able to move around and move out of the room for restocking or to inventory it. These nurse servers, they're built-ins. They're outside of the patient room. I feel like it's a good opportunity for supplies to be near the patient without being in the patient room, so you don't have to worry as much about infection control within the patient room, I think.
That's a good point about infection control. A lot of infection control guidelines require all of supplies that are inside a patient room to be disposed of when the room turns over. So that's something definitely to pay attention to if we're storing supplies in the patient room, bringing infection control into that discussion and talking with supply chain about how that needs to be managed. Because if those have to be disposed and we've planned for all of these supply storage in the room, that could be a huge cost to the hospital.
Before we move on, do you guys have any questions or comments or ideas on decentralized and centralized supplies?
Melody, I had a question. This is Rachel Matthews with HKS. How often are y'all seeing nurse servers? And especially pass-through nurse servers, like where you can access, like where you can put supplies in from outside the room and then someone from inside the room can access them. This is on a patient floor.
It's an interesting concept. I actually haven't seen that yet.
I've seen it once, but it was like 10 years ago.
They used to be like way more popular. We've had some clients that want them and they're so hard to build properly because you often have a smoke wall separating the patient room from the passageway or the corridor outside the room. And we don't see them end up being used because they're just so loud. And then the patient can hear everything that's going in the hallway and it's just horrible. So I was just curious if y'all had seen them or even seen them, quote unquote, making a comeback.
Definitely not.
Okay.
No, that's interesting though.
I don't think we're in favor of them making a comeback. Every once in a while, we'll just get a client that is like so set on them and we have to do a lot of work to convince otherwise that it's a bad idea in terms of supply chain, but as well as just building it in patient satisfaction. So I was just curious.
In there.
It's like things kind of like what y'all are talking about. Like they squirrel away supplies. I love that analogy. But it's just things that you want like right outside the room or you want inside the room, but you want to be able to stock it like at night, maybe when the patient is asleep without entering the room.
That That makes sense.
That's really the biggest like attraction that we have found with nurses.
Was there another question?
Hello, this is Bruce Fong. Can you hear me?
Yeah, hi Bruce.
Hi, how you doing?
Good.
Good. So, we are planning a replacement hospital out in the west side of town, and we went and toured probably a dozen facilities, and the majority of the ones that had nurse servers, they were big fans of nurse servers. We're talking about the staff, and these were the hospitals that we visited were considered best in class. So not to contradict you, I just kind of feeding you that information that there's a large advocacy group, as I would call it, that are supporting nurse servers.
Hey, that is
And
good.
some of the nurse servers that we saw were not pass-throughs. Some of them were solely on the exterior side of the room, the hallway side. Some were were pass-throughs. Okay.
Interesting.
Yeah, I
And,
mean,
and so I can give you the list of those hospitals if you want it, but some were in Canada, some were in Midwest, Dallas, Texas.
That would be
Yeah.
great if we could talk after about this, because I'd like to talk to them and understand what they're doing, and how they see it in the future. I feel like anything built in like this for supplies is kind of locking you in, and it kind of reduces the versatility of the space.
Right, and so when we on our visits, we opened up the cabinets, and it certainly wasn't squirreling, that they were very deliberate about how they managed their supplies.
Okay.
And so they were very proud about those particular facilities, are very proud about how they were coordinated with supply chain, and about what was being delivered to the floor, and how it went from that, let's say, deposit location, and who was then stocking those nurse servers, and what was in those nurse servers.
was there any disparity between supply chain and the nurses in how they wanted to operate, or were they all on the same page?
Well, so what they would generally tell us is that initially in the first 6 months of the new build, that there was that transition period where there was conflict, and they worked it out, and some of them came up with a solution that nursing staff was stocking it, and in some cases it was supply chain staff who were stocking the nurse servers.
Interesting. And that's really a good another example of bringing supply chain in to the design process, so they can have these conversations and really all be on the same page before they start operations.
Well, I mean, it gives me pause, because we're going down that path. We're still in programming. We haven't reached design, but it gives me pause to re-challenge those assumptions.
Yeah, that's awesome. Thank you.
Thanks.
One thing I don't think that we mentioned is that even if you've got decentralized supplies, you still will have a centralized storage supply room on the floor, which could potentially be smaller, but if you ask supply chain, they'll want it twice as big. You ready to move on?
Yep. So we're going to move into the central supply rooms on each floor. But first, we're going to do a quick materials management primer on inventory systems. So there are three main genres of inventory systems out there. There's the manual system, which is what we do with medical equipment. It's things that are not high volume, not moving around a lot, not disposable. So basically, you count all the items, you make your documentation, you make your spreadsheet, come up with what you need to buy, or where things are. In the case of equipment, what needs maintenance, what can be replaced, and all that stuff.
That's the part where we crawl on the floor and get serial numbers when we go do an inventory.
You got it. The next one, so that's for low volume applications. There are some small stores who do that. I don't really see that in hospital supplies. There are periodic inventory systems, which you're checking your stock periodically. It's still a fairly manual process. You're counting your quantities and replenishing periodically. It could be hourly, it could be a couple of times a day, it could be weekly. Smaller organizations that don't have a huge high volume of patients and a lot of flow through, or low cost items where it doesn't really matter if you're not tracking every penny that's going through. What we're seeing most as far as inventory systems is a perpetual system where supplies are barcoded, or the bins are barcoded, or they've got RFID tags, and things are tracked automatically. Data is sent to either a central system, either your supply chain management system or your ERP system. And so the central system has a real-time information on how much you've got in each room at any given time. It is technology intensive. It's good for high volume, high value items like catheters or implants, where you need to keep really good track of this stuff. It does require a lot of work up front, but it is easier in the day-to-day. So when we talk about clean supply rooms, we hear some buzzwords. We hear Kanban on one side, PAR on the other. I think there are probably some others, but these are the two biggest ones that we've heard in designing clean supply rooms. I don't know about you guys, but first time I heard Kanban, I don't know what it was or what it meant, and still a clean supply room, you just kind of put some shelving in it and fill it up. But it's valuable and important to know what these processes mean and what they mean from a technological standpoint, because they do have different implications for the design of the room. So first we go into Kanban. This is a system that's basically a just-in-time system that was developed at Toyota. In the healthcare application, you see it as basically you have 2 bins for every item. They call it a 2-bin system. Each of these bins, each of the 2 bins has the same supplies. You see them front to back on shelving most of the time. So the front and back bins both contain the same supplies. Process. Adam's gonna talk to you.
So this is a quick workflow overview. I'm going to start at the top. So Melody mentioned that the 2 bins are placed front and back. Sometimes they're side by side depending on the cart and the setup you have in the room. But there are 2 bins for each supply. As supplies from the front bin are used, taken to the patient bedside, the front bin eventually is emptied. So the nursing staff, clinical staff will take that first bin and throw it on the top shelf. And that's kind of a visual indicator that we need to restock the room. So then that's communicated back to the supply chain management, which then in turn pulls from the inventory, pulls from the stock, and then restocked back on the floors. The new bin that's brought up is placed behind the other bin, so that it is a first in, first out. So that helps with expired supplies. We hear from Joint Commission often when hospitals have Joint Commission come through that they get deemed for expired supplies. So this is one of those methods that helps with that first in, first out, so we don't have anything expired.
And the system that we're talking about here this is a periodic inventory management system. There are ways to make this into a perpetual system we'll talk about in a second, but first we want to go through a demonstration, I think, of how this exactly works.
All right, so I hope everybody gets the audio on this.
Your department is adopting the 2-bin supply management system. 2-bin is a simple way of ensuring that the right products are in the right place at the right time. The system relies on 2 identically stocked bins for each item, one placed in front of the other. When the front bin is emptied, it's removed from its position, placed on the top shelf in the empty bin collection area, and the rear bin is pulled forward into the front position. When you take the last item from a bin, remove the bin and place it on the top shelf in the empty bin collection area. Then, pull the back bin forward as shown in the following clip. Once an item is removed, do not return it to the supply bin. If you take an extra or incorrect item, place it in the bin labeled Returns. A supply chain staff member will return it to the proper bin. Wait until a bin is completely empty before removing it. Do not consolidate the last remaining items from the front bin into the back bin. The turnover rate of a bin is used to set stock levels. Emptying the front bin early and overstocking the back bin causes inaccurate use data to be collected. When you are not certain where to find an item, refer to the item list. Items are listed in alphabetical order along with the item's location on the shelf.
All right, so we wanted to stop it there. This last little bit where they talked about having the reference guide, that shows how much work up front had to go into organizing all of the supplies, placing them where they need to be so the staff can find things quickly when they go into the room.
All right, so this slide shows a bunch of the different equipment options that you could see in a Kanban room. It goes from the periodic inventory, the manual system, to an RFID-based system. So starting on the left, we have a bin system. We thought this was interesting because it's actually not two bins, it's single bins with dividers in the middle. The back side of the bins has an orange indicator. So when the front side of the bin is empty, you turn it around so that it's a visual indicator to supply chain that it needs to be restocked. This type of system would require somebody in supply chain to have to come around and visually check the rooms periodically and restock as needed. It's a little bit more labor intensive. We do see a lot of shelving in Kanban rooms. If we have a need for an enclosed shelving, this type of system, Kanban can still work in an enclosed system.
You can see that in ORs. Sometimes they have a Kanban system for supplies in the operating rooms, and they'll put it in an enclosed cabinet with a slope top, hopefully.
Yes. If you do want to make that a little bit more high tech, you can get RFID tags that go on the front of these bins, or barcoded tags. This little stock box here, I just thought it was interesting because if you do put RFID tags on your bins, when the bin is empty, you take the RFID tag off and you put it into the stock box, and that's an indicator for supply chain that this supply needs to be replenished in this room. They already know the amount that needs to be replenished because they know the amount that goes in that bin. Another RFID solution that we see a lot here in Denver actually is Pegasus Easy Swipe system. This doesn't have the bins per se, but each of these drawers is divided into 4 parts. So there's left and right, and then front and back. So the front and back sections have the same supplies. When the front section is empty, the nurse would slide this, it's basically an RFID tag, slide it over to show out of stock, and that would send the indication back to the SCM system that that supply is out of stock and needs to be restocked. Any questions on Kanban before we go on?
All right, so now we'll talk a little bit about PAR. You hear PAR on a golf course. So it's the minimum number of items that you need to, at any given time, for each individual item. So whenever the number of items in an inventory falls below that minimum threshold, a reorder should be placed. These are mostly based on automated systems. They're less manual than the Kanban. So I already talked about the expiration, but using the PAR replenishment system is also a way to make sure that your items aren't expired, because you have less supplies in each supply room. So instead of having duplicate supplies in double bins, you basically have one bin, and then it's automatically by RFID or weight-based. Some of these technology systems are pretty high tech. So the typical workflows in a supply room, you've got bins with supplies. Sounds pretty common for everything, a good way to store things. As the clinical staff takes supplies, they can either scan it or one of the higher technology systems will automatically communicate back to the supply chain management. And then from the inventory, restock is taken and delivered out to the floors. So there's a lot of different technologies that can support the PAR, and we just put up a couple examples, especially because they have very different architectural impacts. So this first one on the left, this is wall-mounted louvered panels, and this is from Par Excellence, and they have a weight-based scale attached to each bin. So as supplies are taken, it's automatically logged in the SCM. They know how many of each item they have in the bin at any given time. So it's a pretty automated inventory system. So once the amount of supplies in a bin reaches that minimum threshold, an automatic reordering process typically occurs with their vendor so that supplies show up on the dock as needed. These two cabinets here in the middle, this is an example of what you'd see in a cath lab. These are WaveMark cabinets, and these are RFID. So as these supplies are taken, it's tracked via RFID, and just like the weighted bins, you know what's on hand at any given time. And the cabinet on the far right is a Pyxis supply cabinet, and this one's done by the nursing staff logging into a computer, identifying what they're going to take, and then it opens that specific door so they can take the supply that they need. So we felt it was very important to kind of see these different options because how it affects the design of a room is very different. If you're doing wall-mounted panels, you don't want to put a big electrical strip in the middle of the wall because you won't be able to get the panels on. Conversely, if you're doing the cabinets, you have differing technology and what the data requirements are versus what the louvered panels would show. So focusing on how supply chain wants to manage these in the supply rooms and building in flexibility is something you definitely want to have a conversation with because every hospital does it differently.
So to recap, Kanban, we've got the 2-bin system, fairly manual process, or you can make it perpetual with an RFID system or a barcode system. 2 bins, patients use the supplies, empty the bin, it's restocked, so you end up with 2 bins full. PAR is just a single bin, you end up with less supplies in the room, and it's automatically reordered through SCM. Any questions? Okay.
So we pulled some examples from some previous projects and also our BIM guide through some things together, and especially showing some issues that you might come across when you're talking to supply chain and planning out these systems. So the example on the far left, this shows some louvered panels with some wall-mounted bins, and then a few extra carts in a room. So you can see how the louvered panels kind of open up some floor space. When you're planning a room with the louvered panels, if it's using a system like Par Excellence that has the weight-based, you'll need access to power and data. So those will need to be mounted above the louvered panels. So that's looking at like 80 inches above the finished floor. I'm going to skip over the middle one and go to the right. So this is showing the Pegasus carts with the RFID tags. Now these don't require the same power and data that the louvered panels do, but you do need to make sure that the RFID network that's communicating with the Pegasus carts is available. So the technology differences is very drastic. So you need to make sure that you understand, but you also want to make sure you're building in flexibility. So asking the questions of what power and data requirements there are is really important. And this middle one, this is kind of an example of a manual process, and we did a funky layout on purpose. When you're throwing wire carts in a room, they get moved all over the place. But the funny thing that we always see is this 24 by 24 inch square in the corner that it just becomes unusable. So understanding supply chain needs and how the nursing staff wants to use the space to for their ergonomics and getting to the supplies quickly and easily. It's definitely a staff safety issue. got to keep hitting that keyword of safety. So those were just some examples. So we threw this slide in here for guidelines. Everybody's familiar with FGI. So I put in two of the guidelines in there that talk about clean workroom, clean supply room, and equipment storage. So you can reference those. I think everybody's familiar. The difference between a workroom and a supply room is the need for a sink and a countertop, but there's some more details in there. We also talked about joint commission. They get dinged on expired supplies, sometimes humidity requirements in storage rooms. So those are definitely things to concern yourself with and ask questions to supply chain, and then paying attention to local codes. But all of this information kind of comes down to how can we communicate this with everybody, talk to supply chain, talk to the nursing staff, get everybody on the same page so that we can design the rooms for flexibility, because typically your supply chain is going to want to change their process whenever you do a design project. And so that just throws in all sorts of kinks right there. So paying attention to room size, power and data, network, wall mounted items, if you need to throw backing in the wall for those louvered panels, or if you're going to plan for backing, whether they're going to do louvered panels or not, because they might switch to that in the future. Are there other things that y'all heard about? Feel free to offer up input, questions. They got quiet now.
They did, I know. I think the flexibility is really important, and supply chain has to kind of work through their process as they're looking at a new space, as you're talking through a new space. And as you're doing that, it's important to have them in the room and have them involved in the discussions, because the last thing we need is a supply chain roller coaster. We don't want to design loop-de-loops in their system. We want them to function efficiently. So things that we should ask as we're talking to supply chain and talking to the nursing staff, and we've got everybody in the same room. How do you manage your inventory? What systems do you use? What technologies do you use? How much do you need in extra bulk supplies? Where do you store them? We want to minimize the squirreling away of things, but we also need to make sure that patient safety isn't affected if there are supply chain disruptions. How often do you replenish supplies to floors? How often are you expecting nurses to come in and out of the rooms? What are you expecting the nurses to do? Are they having to use a barcode scanner? Are they going to have to use the Kanban system and keep track of when a bin is empty and move it and replace it? Or are they just going to be able to grab supplies they need and go? These are important things when you're deciding what system you're going to use and really planning out the workflow of a room. That brings us to the end of our presentation. I know a lot of you guys have designed supply rooms, a lot of clean supplies, a lot of hospitals. I'd love to hear what you guys think and what you've seen in regards to supply chain and design.
I guess one question I have is, in the last 6 months or so, have you guys seen modifications to supply rooms based on the COVID, or has that kind of stayed consistent with what the facility has had and they've just kind of managed?
I think the big modification has been the need for PPE. Previously we were doing an isolation cart or 2 or maybe 4 on a nursing floor, or having a few locations for PPE. I think we're seeing that needed in higher volumes and distributed more evenly across the floors. But as far as the supplies in the supply room, I haven't seen a whole lot of difference. Have you?
No, not in each individual supply room, but when we're talking about the main warehouse inside the hospital and the external warehouse, a lot of facilities are going with that, having an external warehouse where they have extra supplies on hand so that they can redistribute to their hospitals as needed.
I saw it described as the just-in-time versus the we'll use it eventually ideology. We've all moved to just-in-time. Well, in metro areas, we've all moved to just-in-time. But I think it's probably, we're going to see more we'll use it eventually stuff
Squirreling away.
coming in. Yeah, and hopefully we can do it in an efficient way that's not actually squirreling it.
Yeah.
Did that answer your question?
It did.
Hopefully we can avoid the supply chain mystery closet that's just full of junk.
What did you guys think? Did you feel like it was did you learn something today? Are there any things that you'd like to see us cover or that you wish we'd covered?
This is Tim with Trainer HL. Yeah, I guess maybe one thing, it's been a while since I've worked on such a really big, university sized hospital, but maybe something, and I guess that's why it's not in there, is that you don't see automation sort of worked into every sort of supply chain management for various hospital systems. But with the automated guided vehicles and coming from receiving closer than to the central distribution centers, maybe that would be something to add in.
That's a good idea. That's next level.
I guess.
Next level automation for sure.
Yeah, so I've seen the sort of the tower laser ones only in my experience. I haven't seen any of the magnetic ones. And I've only seen that implemented at Ohio State,
Okay.
Wexner Medical Center. Yeah, that might be something.
Okay. Awesome. We'll look into that. Thank you.
I do see a question came in about kind of infection control and cross-contamination if supply is being covered when they roll between central supply and the patient rooms. Sometimes I see those boxed, but I've not seen supply carts that are covered when they're delivering supplies.
It might be.
It might be.
Yeah, we don't sell anything. We do plan for carts that have those covers. So yeah, that's a good point.
I've seen a lot of totes.
Yeah.
All right, anything else? Could everybody hear the video during the presentation?
Yeah, I did.
Yeah, it came through just fine.
Yep.
Good. We were worried about that.
All right. Well, if there are no other questions, thank you guys for joining us tonight. I hope it was valuable. And reach out if you guys have any other questions or want to go over anything with us. We're available.
I hope I get to meet some of y'all in person sometime in the future.
Yep.
Thanks, you guys.